Hi, I'm Leola. I'm going to be your nurse today. Do I have consent to get some information from you today?
Yes.
Okay, perfect. I'm just going to ask you some questions, just a general assessment tool today. I know the doctor already did come in and do your assessments, but I'm just going to get some further information for when we can put in your chart for later.
Perfect.
All right, so first I'm just going to start with some basic information. Can you give me your name?
Maya, M-A-Y-A.
Perfect. And then, do you have any allergies?
No.
And then, what's your diet?
General.
General diet. Height and weight.
5'4", 150.
All right. Then we already got vital signs from earlier. How old are you?
21.
Sounds good. And your sex?
Female.
And race?
Caucasian.
And then name and phone number of significant other.
Michael, and I can't remember his phone number off the top of my head.
That's okay. And then dominant language.
English.
And marital status?
Single.
Ooh, I'm sorry.
That's okay. No problem.
Wasn't very therapeutic of me. And then where do you live?
Dodgeville.
Dodgeville, Wisconsin.
Mm-hmm.
And what is your complaint of coming in today?
Annual checkup.
Just an annual checkup. Do you have any diagnoses that made you want to come get a yearly checkup, or is it just in general?
Just general.
Okay. And then conditions of admission, you said there are none, just...
None, just general
Okay.
checkup.
Today is the September 8th, and it is 2:55. Are you accompanied by anyone today?
Nope.
And then how did you get here? Did you walk? Did you use a wheelchair?
I
Walker?
walked.
You walked. Did you use any assisting devices?
Nope.
And then were you admitted from anywhere, or did you just come from home?
I just came from home.
Okay, sounds good. All right, now we're just gonna go on some predisposing factors, so just things that might make you more prone to different disorders. So for your family, where is your family from? Like, where's their origin?
Family of origin, like if we're going way back, I guess it would be like Germany, Norway.
Okay.
Otherwise, like my current family lives in Portage.
Okay.
I think that's what it's asking.
Okay. And then what's your and then you said present family's Portage. And then what is your relationship between your family members? Like, how does your household set up?
Household setup, I have a mom and a stepdad and 2 step siblings.
All right. Now moving on to more medical and psychiatric history. Do you have any previous mental health problems that you've had in the past?
Not that I know of.
What about your family? Have they ever had any issues with mental health in the past?
Depression.
Depression. Do you have any other influences that are affecting your adaptation? No. All right. So now moving on to more cultural. Are there any what are your environmental factors? So like you already said your living arrangement, but what about like your neighborhood?
My neighborhood is pretty normal.
Okay.
No problems there. Safe neighborhood.
And then when it comes to health beliefs and practices, what is your responsibility for your health, or any special things that you might do for your health?
Staying up to date on vaccines, annual checkups.
And do you have any religious beliefs or practices?
Lutheran Christian.
Sounds good. moving on to education. What's kind of like your education background of where you stand right now?
High school diploma.
Sounds good. Have you had any significant losses or changes recently?
Not recently.
What about peer/friendship relationships?
I have friends.
Okay. Occupational history. What is your past work experience like?
Fast food and healthcare.
And then previous pattern of coping with stress. What do you do in times of stress to help?
Let's see. During times of stress, I utilize walking.
Walking. And then do you have any other lifestyle things that contribute to your adaptation to different stressors or anything of that sort?
No.
Okay. Alright. Do you have any support systems right now?
Yes, my family and my boyfriend.
And what is your financial situation like right now? Do you have pretty stability right now?
Stable income.
That's good. And then what is your current job status?
Employed.
And then role, contributions, and responsibility for others. So what do you do to help others, whether it be public, family?
My boyfriend and I, we split rent. We pay. I take care of like groceries in that aspect and kind of care for the home.
So kind of splitting up responsibilities.
Yeah. As for my family, since I'm no longer home, that doesn't really apply.
Alright, and then, well, it's not really an illness of why you came here, but is there any situation or event that made you want to come for an annual checkup? Any, like, concerns that made you want to come here, or just
No.
annual?
Just annual.
Okay. And then your understanding or description of stress or illness or expectations of hospitalizations, but just physical, so it's kind of you know what to expect.
Yeah.
Yep. Just kind of getting an idea of how your health is. Alright, now for adaptation responses, let's see what we have. Do you have any anxiety right now?
No.
No? Okay. Are you seeing anything that I maybe wouldn't be able to see? Like maybe person, thing?
Nope.
Okay. What are things that you like about yourself?
I like my work ethic.
Anything you'd want to change?
Procrastination.
Alright. That's all objective stuff that I will fill in later. So objectives is just me observing you. That's kind of some of the information I'm going to put down. So nothing you have to worry about. You can always look at it in your chart afterwards and just see if everything's good.
Perfect.
And you said you haven't had any losses or changes recently?
No.
No, okay. Can you state like a recent memory that you've had within like the past week or so?
Recent memory would be going out and buying pumpkins.
And then what about like a remote memory? One that was maybe a few months back.
Remote memory.
Or longer.
Taking my dogs for a walk.
Alright. And we know that you're an oriented person. Do you know what time it is right now, or at least the date?
Ballpark 3:00.
Mm-hmm.
Date 9/8/25.
Yep. And then do you know where we are right now?
Southwest Tech.
Yes. And then do you know like why you're here?
Annual checkup.
Yes. Do you have any ideas of destruction to yourself or others?
No.
Do you have any intent to self-injure yourself? No. And do you have any suicidal ideations of wanting to die?
No.
Have you ever had a history of ideation or suicidal thoughts?
No.
Do you have any symptoms that you are experiencing from stress
No.
at all? Like, do you feel like you have a stressful, like, life or time?
No.
Or stress affects you at all?
No.
And are you taking any medications right now? Any prescribed medications?
Birth control.
Okay. Is that the pill?
Mm-hmm.
Okay. What about like over-the-counter drugs? Do you use like Tylenol, ibuprofen?
Tylenol.
Tylenol. And I'm assuming for pain.
Yes.
Okay. And then do you use any street drugs or alcohol? And then this other part is just the assessment, which we already had the doctor do. So I will just kind of briefly go over that, see if there's anything I need to specify. Have you ever had, do you have a history of seizures at all?
No.
What about any fainting spells or passing out? Dizziness at all? Do you have any tingling or numbness in your extremities at all? Do you have a history of like hypertension, palpitation, shortness of breath,
No.
heart murmur, pain in legs, edema? And I already asked about numbness and tingling. And then I already asked about your usual diet pattern, which is general. And do you have any food allergies?
No food allergies.
Okay. Do you have any dentures?
No.
Any problems with chewing or swallowing food or liquids?
No.
Any changes in weight recently?
No.
Any problems with heartburn?
No.
Nausea or vomiting?
Mm-mm.
And do you have a history of any ulcers?
No, I do not.
Sounds good. And then what is your usual bowel pattern?
Daily.
Daily, okay. And do you struggle with any like constipation or diarrhea?
Nope.
What about your voiding pattern? Would you say it's pretty regular?
Pretty regular, yeah.
Do you have any urinary hesitancy?
No.
Do you have like increased frequency of urination?
No.
What about like needing to get up to pee at night?
Oh, no.
What about pain or burning?
Mm.
And then any incontinence?
No.
Any genital lesions?
No.
Any discharge or odor?
No.
And do you have a history of any STI, sexually transmitted diseases?
No.
And then do you have any concerns about sexual activity or anything of that sort?
No.
Sounds good. And then you did say you used the pill for birth control?
Correct.
And do you remember the date of your last menstrual cycle?
Ballpark 8:15.
Okay. 25?
Yeah.
And then do you know like an estimate of how many days that cycle?
5.
5. Do you have any problems associated with menstruation, like cramps or any of that sort?
No.
That's good. In your breasts, I know they did an examination already, but have you noticed any like swelling, lumps, discharge, dimpling?
Nope.
And then have you ever done like self breast examination before?
Yes.
Okay. Just a little more and then we'll be done.
Mm-hmm.
So I'm just gonna look at your eyes now. Do you have glasses?
No.
Contacts?
No.
Swelling?
No.
Discharge?
No.
Itching?
No.
Blurring?
No.
Or double vision?
No.
Sounds good. Now we're gonna move on to your ears. Do you have any pain in your ears at all?
No.
What about any drainage?
No.
Do you have any difficulty hearing?
No.
Do you use hearing aids?
No.
Have you ever had ringing in your ears?
No.
We do not have any lab values as of right now, so we don't gotta worry about that. What would you say for exercise? What kind of exercise do you get, and how often do you do it?
Type of exercise: running, walking, and weightlifting. And I would say every other day.
Perfect. And then what do you do for leisure time activities?
I watch TV.
And for sleep, how many hours would you say you sleep per night?
8 hours.
And do you use any sleep aids like melatonin or anything like that?
No.
Do you tend to wake up during the night?
No.
Do you feel rested upon waking when you sleep?
Yes.
For activities of daily living, would you say you're independent, or do you need assistance with like bathing, getting some food, walking?
I'm independent in all of my ADLs.
Sounds good. All right, I think I'm just gonna do one more look down to make sure I got everything before we leave,
No problem.
just so I don't have to give you a call. I do have one more question.
Okay.
Do you participate in like group activities and interact with others?
Yes.
Yes. All right, and we already got your assessment in, so I believe that is all I need from you.
All right.
Any questions or anything before we
Nope, I
head
don't
out?
believe so. All
All right, sounds good.
right. Thank you.
Thank you.